Hey guys, I'm David DiMuzio, and I recently came across this article on Turkey hair transplants. It was on this guy's experience. His name is Harry Wallop, and he writes for the Daily Mail, or at least that's where I found his article. And he went to Turkey and was going to get a hair transplant. And there were some really interesting things in this article that I think are definitely worth checking out. So I'm going to link to the article in the video description. But there were a few specific marketing terms or lies or propaganda or whatever that we might want to call them that he was alarmed by that I didn't really understand. And so since I'm here with Dr. McGrath, I thought I would ask Dr. McGrath what they might mean by some of these terms. So the first one isn't really a term, but this was just something that he was told. So this guy, Harry, when he went to Turkey, it was with this, he was going to get a hair transplant done by Cosmeticium. That's the name of the company. Here it says, Cosmeticium initially told me that it could move 5,500 grafts on my head. After seeing my photos, it revised this to 4,300. It was one of several clinics that offered to harvest more than 4,000 grafts. So this was going to be with an FUE procedure. Why would anyone be worried about that, or should they be, if a clinic of any kind tells them that they're going to harvest over 4,000 grafts using FUE? And also, this clinic had not yet seen him. Yeah, so they originally told him that they could move 5,500 grafts on his head before they even saw his pictures. Then after they saw his pictures, they revised it to 4,300.
Not uncommon. So to just speak in some generalities, when we're talking about FUE and follicular unit extraction, yes, we want to try to move as much hair as we can, and the more hair we can move, the greater density we can achieve, but there are limits. And it's widely accepted by the best surgeons in the world that you really don't want to get, close to that, 50% mark. And what I mean by that is we look at the density in the back of the head, and we have what we call the safe zone. And if someone had reasonably good density, anybody could probably harvest 4,000 to 5,000 grafts out of the back of it, but that's going to likely create a very profound decimation of the donor region. It's going to be very visible. Mm-hmm. And just the mere fact that you can do something doesn't mean that you should. We're always trying to keep a balance in our art and our science of hair restoration, particularly with, Caucasian men. And my understanding is this gentleman was Caucasian, and you have to be a little bit careful about how much you harvest because it can make the back look like it's moth-eaten and it's destroyed, and then you're kind of stuck because you don't have anything left. So we try to take into consideration that there are limits to how much can be moved. Now, most good surgeons around the world would agree that if an individual has, good donor hair, that we typically can safely transplant 2,500, 3,000, maybe a little bit more on an individual and do it safely. I know a number of surgeons here in the U.S., some of the best in the world at FUE, that do that routinely and it's very safe. There are some I know here who are some of the best in the world with FUE, and occasionally they can get higher graft counts if you've got, say, a young man who's of Middle Eastern descent and his hair is really strong, and so occasionally you can get higher numbers. It's not to say that it's not possible, but the thing that's concerning to me is that they routinely say, hey, we'll move 4,000 to 5,000 grafts, and they haven't even really examined the patient, and that's really something that should send off alarms in anyone's mind, because I could probably do that too, but you're going to end up with a lot of balding in the back of your head. Now you're trading one problem for another, not to mention how are those 45 or 4,000 grafts going to be used? How is it going to look? And so there's a lot to this.
Yeah, later in the article, actually, it talks about another guy that went through the exact same thing, and he ended up just with that moth-eaten look. So it's like just traded that one problem for the other.
And once that happens, there's not much that you can do about it.
Because you've already decimated the donor area.
It's gone. And I think, Dr. Steve Gable is a colleague of mine. He's a phenomenal surgeon, and he actually came up with a pretty interesting and very accurate formula actually, for determining exactly how many grafts can be harvested safely. And many of us will go to that and use that formula.
One of the other marketing phrases that I didn't really understand when reading this article was a few of the clinics mentioned that they offer sapphire FUE hair transplant with the gold method. Cosmeticium said they too used sapphire blades to extract the grafts, which was more kind and gentle. What does this mean exactly? What are sapphire blades with the gold method?
When any surgeon is performing a follicular unit extraction procedure, the device that we choose to use is going to be the one that typically we are most comfortable with. Now, a sapphire system in the right hands is fine. And all of us want to have blades that are as sharp as they can be if you're going to do a sharp extraction versus a blunt extraction. Those are two different types of extraction methods. So these are very nice terms, but, for example, one of the more popular systems around the world would be, say, the WA extractor. A lot of physicians really like the WA. It's very clean, it's relatively atraumatic to the degree that it can be. Do understand, no matter what you're using, you have to extract the graft. And in order to extract the graft, you've got to be able to pierce the dermis. You have to get through the dermis, the epidermis, so that you can create enough of a size hole that you can then gently remove the graft. It doesn't matter what system you're using. The common factors remain the same. It is a surgical procedure where you're using a blade, whether it be super sharp or blunt, and you're piercing the skin. So and you're creating a hole.
Would there actually be different reasons to use a blunt blade in certain cases? I know that just sounds, as me as a layman, I just think, oh, you're going to punch me with a blunt blade? That just sounds bad.
Well, yeah, no, and understandably, and the truth is, it's not truly blunt. It's just not quite as it would be with a very sharp extractor. There's two basic types.
Okay.
So the purpose with the blunt is that in some surgeons' hands, they feel more comfortable and feel that there can be less trauma to the actual follicle if they're using a blade that isn't quite as sharp. And I think that's just purely by choice. Jim Harris, for example, is a great surgeon. He likes a blunt extract. There's nothing wrong with that.
Yeah.
I'll give you myself, for example, and I've used all the different systems. For me, I'm more comfortable with something that is a little sharper because it allows me to have better control. My depth control is better, and I don't have to worry about going too deep. And if you just get to it's all a matter of feel.
Gotcha.
So everyone's a little different in terms of the surgeon, but don't be misled. It's all surgery, and you have to pierce the dermis, and there's going to be a small scar. No matter how you write it up, no matter how you look at it, you can dress it up any way you want, you're still doing surgery, and you're having to extract the graft. If you don't get it out, you can't use it. You've got to pierce the dermis to get through to be able to extract the graft.
It sounds almost like, I was thinking guitar strings. Like some guitarists will be like, I use 9-gauge strings, some 13-gauge strings, and ones will claim that like tone is better on one than the other, but it really comes down to the guitar player.
Yeah, well,
who's playing those.
That's a great example. Yeah. And so if someone's a very skilled guitarist, I think they could probably make any guitar sound really good.
Yeah.
I think that's a very good example, because if you're a skilled surgeon, you can use any system and get a very good result. I'll tell you, for example, some of the best FUE surgeons I know in the world will sometimes use just a manual extractor where there's no mechanized or motorized function to it whatsoever other than the surgeon's hands. Now, obviously, that needs to be a sharp blade.
Okay.
If it's not mechanized, it's not rotating, you've got to have a really sharp blade that allows you to, and I know some of the best in the world that prefer that. They feel like it's a better feel for them. So again, it's all great to hear these wonderful phrases and different things, and it sounds like, ooh, that sounds great.
Yeah.
But it comes down to the skill of the surgeon. That's it.
Makes sense. Here's another one I wanted clarification on. Cosmeticium, like many Turkish clinics, promises 100% painless, needle-free anesthesia. This is a common marketing promise in Istanbul clinics. Highly pressurized air or liquid is used to penetrate the scalp. In most cases, after this has been administered, a needle then injects local anesthetic. So Elite Hair Transplant, which is another one of the clinics that this this guy researched in the article, also boasts of its patented needle-free anesthesia. So can you explain this? What are they talking about?
I will certainly do my best. So when we're doing surgery, we all know, and David, you've had a few surgeries, you know that we have to somehow anesthetize the scalp.
Yep.
And for some patients, that initial anesthesia, there's a reason why it's a little bit uncomfortable. The reason behind that is that, say for example, the lidocaine has a different pH than your skin. So when you inject the lidocaine, you're going to feel a little bit of a stick with the needle, but then you'll feel the burning.
Yeah.
Now, there are ways that we can combat that and make that pH less, but what we found is that when we do that, which is adding a sodium bicarb, it helps to buffer the solution, but it creates a tremendous amount of swelling. So we try to avoid that. So what they're referring to is a method by which you can do some light anesthesia using basically is like an air gun, where it's just going zap, zap, zap. And I've seen it in use, and yeah, I think it's reasonable, but my experience has been that you still end up having to use the injectable lidocaine, and there's still going to be a little bit of burning. I think that the best way I can describe this to anyone that's worried about it, you know, the anesthesia is what it is. It's never really anything that has you know, slowed us down. I think it again comes down to the skill of the injector, and the example I'll use has nothing to do with hair transplant. Now, we've all been to the dentist, right? Some of us have had experiences that aren't so pleasant, and then other dentists are like amazing. Like you go there and you're like, I didn't feel anything. I mean, they're just so good. Some of it has to do with their injection technique. Some of it is they use a more dilute form to start. They use distraction when they inject it. And so these are all methods that we can use. Distraction, using a vibration to distract it. But ultimately, you still have to get the anesthetic into the skin.
Somehow.
And there really isn't like a magical system that makes it completely pain-free. That's like a lot of the advertisements I see around the world, and even, to be honest with you, sometimes here in the U.S. as well, where, you know, a physician will tout that this is a scarless procedure.
Yeah.
Well, we all know, don't be fooled, there's no such thing as a scarless procedure, even with FUE. I mean, the fact of the matter is, the studies have shown that when you do a large FUE, the total surface area of scarring is actually greater than that with a strip excision.
It's
so
just hid.
it's just a nice thing that people like to hear. They love to hear painless. Well, who doesn't like painless, right? I mean, who wouldn't want that? But, you know, painless, hey, everybody loves painless. But listen, nothing is completely painless. You're going to have a little bit of, but I think when it's done properly and carefully by, again, a skilled surgeon, I think it's not a big deal, and most patients tolerate it just fine.
I know for me personally, it wasn't really a big deal. Like I've had an S&P done, and that was about the same thing. Like it's just you feel some kind of little prick for, I don't know, how long does it normally take, the numbing portion?
You know,
like an average.
I'll use myself as an example and how I prefer to do it. So when we start the procedure, we'll have the patient somewhat sedated, so they're a bit relaxed, and that's helpful because even if they have a little bit of discomfort, most of the time they don't even remember that. But from my experience, there's a couple of ways you can do it. You could either do it super, super slow, which of course, takes its time and they're still going to feel a little bit of discomfort, or you can get through it rather quickly. So I always opt towards using a little bit more dilute solution of lidocaine and just try to get that ring block done as quickly as I can, because now we're looking at 1 or 2 minutes of them being a little bit uncomfortable, and then it's done.
Yeah.
Once the first round is done, then they don't feel anything, because then we follow it up with marking. But now 95% is numb. They might feel a little pinch here and there, but after that, they're numb for the whole day.
And what I understand, you mentioned earlier this sodium bicarbonate, right? You can mix that with a lidocaine, which can kind of lessen the feeling,
the burning,
the burning. But the thing is, from what I understand, that also, the more sodium bicarbonate you use, the more potential there is for swelling as well, right?
So it's been found across the board, and I certainly have found it too, that whenever we mix sodium bicarb with the anesthetic, first of all, you have to make sure you use the right amount, because if you use too much, then what ends up happening is the anesthetic doesn't really become effective, because it all sort of dissolves out. But you have to use the right amount, and for some reason, when we use sodium bicarb, particularly in the frontal region of the scalp, when we numb it up, afterwards patients get an inordinate amount of swelling post-operatively.
Yep.
And I've seen it happen many times where normal case, nothing's out of the ordinary, but if they had bicarb, they'll almost always call and say that the swelling's down to their eyes now. And so we learned that if you can avoid using the bicarb, you're really going to be in a better place. And so from my perspective, you have, 30 to 60 seconds of a little bit of discomfort versus 2 weeks of swelling.
Yep.
I think that's a fair trade-off.
I had basically no swelling with the surgery that I had with you, and the one that I had had prior to that with another surgeon, there was I looked like a different person. There was a lot of swelling, so I was wondering why that was on that surgery with you. And then I remember you mentioning to me afterward that you didn't use as much of the sodium bicarb, and so that decreased the swelling. So there's a lot to kind of take into account, guys. Most things when you're getting a little bit more of one thing, you're probably losing a little bit on something else. So this is all very important things to weigh, and hopefully this helps fill you in a little bit more and answer some questions. If you're reading this article, you'll know a little bit more what they might be talking about when they're talking about some of these marketing terms.
Yeah.
Thanks for watching.
Thanks, guys.